Today, we're very happy to have Dr. Patrick Quaid. He's an author of Learning to See, Seeing to Learn, Vision, Learning, and Behavior in Children. He's also at the View Vision Therapy Clinics in Guelph and North York, Ontario. Also joining us today, Matthew Turton, who is the Director of Breakthroughs in Learning in Waterloo, Ontario. Welcome, both of you. Why is collaboration important when it comes to understanding vision and learning? How is that essential when it comes to looking at other professionals and integrating different areas of knowledge and our increasing understanding?
Well, I think it's important because we're all siloed in our own areas. You know, you look at optometry. I mean, we're very siloed on vision care and visual processing, and that's important. But there's also phonics. There's also behavioral characteristics of these kids. There's so many. It's so multifactorial. And as I often say to the parents that we're treating, is that we do not teach your child how to read. We give them the fundamental visual skills that are required in order for the reading reflex to emerge. And I think that's a very important distinction. So collaborating, for example, with places like Breakthroughs in Learning. So when we put those visual skills in place, you often see a reduction in symptoms. Like the child will say, I can see things clearer. My eyes can move on the page a bit easier. I don't get things coming in and out of focus. I don't want to put the book down after 5 seconds. We can make those things better. We can improve that child's ability to remember what they've seen. So sight words. But ultimately, as Matthew alluded to before, giving these children the context and the nuances of what's behind what I'm reading, giving them the confidence to know that they can do it. There's also this thing that I call the failure syndrome that you see in these kids, where even if you treat the visual problems, and we see it in the therapy room, if you do an exercise or a visual skills task with the children, we call them vision experiments, because if you call it a vision test, they're not very fond of the word test. So you say a visual experiment. If they start to hit a barrier where they struggle a little bit, you'll often see the armor just goes up and they shut down, because they're used to having that trouble in the classroom where, and I'm not saying this is bad from the parents or the teacher standpoint, but they've heard the words try harder. And they're like, well, I'm trying my best. It's not that I'm not trying my best. So I think in the therapy room, we have to be really careful to set the level of therapy appropriately, so you don't result in that armor going up. So I think that's our role, is giving the child back confidence in their visual skills. And then we pass on to either somebody like Breakthroughs in Learning. Sometimes there's an educational psychologist involved, the teachers involved. Obviously, the parents are probably the most important partners. I always tell parents, it's not the sole job of the school to educate your child. It's a partnership between the parents and the teachers. And most parents understand that. Some that don't, but most do. But I think giving that child back confidence in their visual skills is our number one job, but also trying to make sure that the other parties involved in the management of that child understand where vision fits, but also just as importantly, that we understand where they fit in. Because what was the old saying I've heard? The difference between an excellent doctor and an average one is the excellent one knows when to get other people involved. And I think that's a really, really key statement. What's that old saying? If you want to go fast, go alone. If you want to go far, go together. It's a really appropriate saying.
Yeah, I think there can sometimes be ego involved, right? Like, I have the answers to every problem. That's wildly unlikely. And we talk about, no one toolbox has all the tools for every client that I'll ever see. We work with a very wide range of people, from little kids to senior citizens. And so we need more people on the team. And we refer to it as that person's name. I'll say Jimmy, as Team Jimmy. And we need a lot of different people from various fields, often, certainly the parents in the school, but sometimes these kids they're no longer kids, and they've kind of shaped their identity around the struggles and the challenges that they've had. So not even looking at just the learning challenges and help with that, but they may also need some help reshaping their identity, dealing with some behaviors that they've created as coping mechanisms. They've told themselves that they hate school, that they're dumb for the last decade. And that's not something you can just shake overnight because Dr. Quaid has helped your vision and I've helped your cognitive skills. That might need some extra help. When I talk to the kids specifically about math, I can help you develop the cognitive skills to be a successful math learner, but you still need to actually go study algebra. And if you are in grade 12 and you didn't get that in grade 9, let's say, you probably need to go to a tutor, right? And get caught up on the the actual content knowledge. I helped you with the cognitive skills, but you need to go get caught up on the content knowledge. And so it really does, take a village of people working together to support team Jimmy. And lots of people I see absolutely need Dr. Quaid's help. Some of them, before I can do anything, they need to get that vision system aligned and working well, and then I can take them to the next level. It takes a team.
And I think, Matthew, you raise a really good point about labels. And I think I just want to say something on that very quickly, because I had a kid in my clinic last week who I think he was about 11, and he literally said, as soon as he sat in the chair, "I'm an ADHD kid." It was the first thing he said. And I thought, no, I said, "You're a child with attentional problems. There's a big difference." And I think, one of the very first steps in the consult I do is I raise the chair up so the kid's looking at me eye to eye, so I'm not this big towering doc staring over top. But I think giving that child a sense of, oh, okay, so this is something that I'm wrestling with. And I use the analogy of, it's like telling somebody with a broken leg, why can't you run around the track? Everybody would scratch their head and go, well, that's a dumb statement. Why would you say that? So giving these kids back a sense of themselves, and not them being driven by a label that they've learned to use as a defense mechanism to not realize that there's actually something going on that can actually be helped.
We've been joined today by Matthew Turton, who is the Director of Breakthroughs in Learning in Waterloo, Ontario. And of course, Dr. Patrick Quaid, View Vision Therapy Clinics in Guelph and North York, Ontario, the author of Learning to See, Seeing to Learn, Vision, Learning, and Behavior in Children. Thanks for being with us today.
Thanks
for having us.
Thanks for having us.